Hello and welcome. Do you have a thick voice? Do you think you're overweight even when you're not eating too much? Do you or your friend has irregular menstrual periods? Do you think or your friends think you're too moody? Or are these the same symptoms your spouse has it? Probably. We are talking about somebody who's got a thyroid disorder. Welcome to all today, this month, the January, which is the Thyroid Disease Awareness Month. Do we call it a disease or disorder? You check it out. But thyroid affects almost 1% out of 10 people in and around the globe. Half of the Americans apparently have a thyroid disorders undiagnosed. Not one or two. In my experience of 20 years, I have seen a couple of hundreds of patients who go undetected because they never thought that they have a diagnosis called as thyroid. And they've not taken the treatment for it, and it has got a long-term effect. What is thyroid? Thyroid is a hormone which is released by the gland called as thyroid gland around the neck. Here, this is what I'm talking about. You have a small gland, but this thyroid gland is very important one. And this January, let's talk about the symptoms which you and me or anyone can have because of thyroid disorders. Remember the acronym THYROID. That is the spelling of thyroid. T is for thick voice. Yes, if you have a thick voice, thick skin or hoarse voice, probably you have a thyroid. If you have hair loss, even when you take good care of your hairs, you probably have a thyroid. And Y is for yellow discoloration of skin that sometimes happens very easily seen in the white people, but not in Indians. R is restlessness or resting tremors. If you have hands which are like kind of shake, even when you're not doing anything, you can be having a thyroid disorder. O is for obesity. O is for overweight. You do not eat regularly, but still you're putting a lot of weight, you can be having a thyroid. I is for iron deficiency anemia. That's what a thyroid patient usually ends up with. And D, not to forget, disorders and the problems with menses being normal or regular. There are people who can go amenorrheic, that means not having periods at all for 2 to 3 months or even 6 months. Thyroid affects the whole body right from the head to toe, just like your diabetes. So this January, the Thyroid Awareness Month, let's spread the awareness about thyroid because yes, the ones who get it, they don't even know they have a thyroid. And it's a bit troublesome because their spouse and the family will not be able to understand why this person is so irrational and illogical. If you find anybody, even me, illogical, I think we need to check our thyroid levels, that is a TSH. So most important blood test to be done is a TSH, and that should be done in almost everybody once in a year. And if you have these symptoms which I talked about it, then you should do it every 3 months. One normal report does not exclude thyroid. You must consult a specialist. I am available for you, Dr. Ashish Chauhan, consultant physician, diabetologist, and adult immunization specialist. I love to treat people with diabetes and thyroid and anything which is related to lifestyle disorder. Available at Apollo Hospital, Secunderabad, or at Ethan's Clinic, Garden Towers, Massap Tank. And for all the updates, to watch our channel and these videos regularly, don't forget to press the bell icon. We want to come back again to you with a new update related to your health. Connect with me at 810-612-7475. Let's share this video this January to every single friend of ours who, without knowing, may be having a thyroid. Take care. God bless. Namaskar.